breaking down barriers to mental health support. Today, we explore the transformative realm of telehealth for mental health solutions. In a world where accessibility is key, join us as we delve into how telehealth is revolutionizing mental health care. From virtual therapy sessions to mental health apps, discover the innovative solutions bridging the gap for individuals seeking support. Stay tuned for insights into the benefits, challenges, and the profound impact telehealth is making in fostering mental well-being from the comfort of one's own space. Today, we will talk about telehealth for solutions of mental health. So before we get started, make sure to hit that like button, also subscribe to my channel. Telehealth is a safe and convenient option for getting behavioral health care at home. You may be able to attend appointments without needing transportation, taking time off work, or arranging for childcare. The healthcare system has reached a crisis point. Millions of Americans who suffer from mental illnesses can't find care. According to the National Institute of Mental Health, an estimated 1 in 5 adults suffer from a mental illness, and more than half do not receive treatment. As a psychiatrist, I've seen patients wait months before their first appointments. More than half of U.S. counties have exactly 0 psychiatrists. This is unacceptable. But there's a promising solution in telehealth. Unlike other medical specialties where in-person physical exams are critical, psychiatry uniquely depends more on building trusted relationships that can lend itself to this form of remote healthcare. Barriers to reaching mental health patients. I find that stigma serves as a major barrier for those seeking mental health care. Many do not feel comfortable sharing their struggles with their family members or friends. Some of my former patients went to extraordinary lengths to hide from their loved ones the fact that they were seeking mental health care. Overcoming this culturally ingrained stigma should not have to be a prerequisite for receiving care. Convenience is another barrier those in the industry need to consider. Taking an afternoon off every week to attend in-person therapy sessions is a luxury that most people cannot afford. The National Council for Mental Well-Being reports that nearly half of Americans know someone who has had to drive more than an hour round trip to seek mental health treatment. Lastly, the match between clinicians and patients is particularly important in mental health. The more clinicians to choose from, the better patients can find clinicians who fit what they are looking for. 3 areas of focus for the industry. Taken together, these barriers illustrate why mental health clinicians need to meet patients where they are, not the other way around. Telehealth in mental health is just getting started. What do we need to do in order to get to Telehealth 2.0? Here are 3 areas where the industry should focus. Historically underserved communities. Telehealth can be leveraged to help those who have been historically disenfranchised, which includes those who are geographically outside the reach of clinicians, as well as those who are culturally disenfranchised. Many ethnicities are particularly averse to the idea of mental health care. Telehealth providers should prioritize hiring a diverse group of clinicians who can understand cultural contexts and the unique challenges facing any given individual. Furthermore, marketing campaigns should be tailored in a manner that is culturally sensitive and accessible. Lastly, telehealth solutions can serve as a first option for care. But should patients require an escalation in services, telehealth providers should be able to refer them to in-person care as needed. Brick-and-mortar clinics, hospitals, and telehealth providers should partner to create an integrated experience that puts the patient at the center. The future of care will allow patients to move seamlessly between different levels of care. Outcome-based measurements. Shockingly, the vast majority of mental health professionals do not measure clinical outcomes. A survey in 2015 showed that a large percentage of psychiatrists do not even use electronic medical records. Without data on how patients are doing, clinicians will have trouble knowing which of their patients needs their attention. Lessons from telehealth practices can help address many of these issues. Given that telehealth platforms are built on newer technology platforms, important clinical measures are more easily monitored. Depression scores, compliance with medications, and other data empower clinicians to adjust their treatment plans accordingly so that patients can get better faster. For example, you can determine which patients have not completed their labs and remind clinicians to get in touch with those patients to ensure that the labs are completed. You can scan patients' messages for suicidal content using machine learning. and proactively reach out to those patients within minutes. This is just the beginning of how data can be leveraged to improve care. Affordability. Cost is a major obstacle to care. Millions of Americans struggle to find a mental health care professional who takes their insurance. Studies show that the acceptance rate for all forms of insurance is significantly lower for psychiatrists than for physicians in other specialties. Many psychiatrists hesitate to take insurance given the low pay, burdensome logistics, and delays in payment. They are often wary of taking on the toughest cases. It's a shameful fact, but I've seen many psychiatrists actively avoid taking on patients with suicidal thoughts. Why take on a high-risk patient when you get paid the same for taking on a mildly depressed patient? Our most vulnerable patients end up having the hardest time seeking care. This is unconscionable. Including these patients is not only the moral thing to do, but it helps improve the reputation of our industry. In this current situation, the two most crucial considerations are the quality of the telemedicine service delivered and its safety. As the telemedicine revolution is gaining exponential momentum, the practices embraced amid this pandemic will resonate all through the lobbies of clinics and hospitals for the predictable future. Once the telemedicine's patients, providers, administrators, and policymakers see that this model works, it cannot be undone. Therefore, telemental health might be the option to alleviate the risk of physicians or patients being infected while still providing treatment, especially where there is a scarcity of psychiatrists and other mental health professionals. Again, while private insurers remain interested in telehealth, it may not be a boon for private practices, even if they decide to continue reimbursement after the public health emergency ends. Mitigate the shortage of mental health professionals. As mental illnesses become more and more common, we are beginning to understand on a global scale just how important mental health is. However, we still do not have enough mental health professionals to treat the millions of people who require care. Telehealth is a wonderful option to lessen the gap because it only requires that the patient has a stable internet connection and a laptop, computer, tablet, or smartphone with a camera. The simplicity of telehealth allows mental health professionals to access their patients regardless of location. If you like this video and would like to see more like it, please give it a thumbs up, leave a comment, and click to subscribe button.